All right, so again, welcome to Epstein Barr Virus Healing Basics. And this is my disclosure. Please read it and follow up with your health practitioner. All right, so before we start, I would like to see who is here. So if you have EBV or you think you might have, put a number 1 in the comments. If you're here because of a loved one with Epstein Barr virus or possibly has Epstein Barr virus, put a number 2. 3, if you're a healthcare practitioner and just want to know about EBV and maybe have a client who might have it. And then number 4, if you're just here because you want to learn. So this is what my hope is for you, that you will understand what EBV is, what the medical society's view on this topic, why it is important to know about this virus, and I give you research studies, and we have a brand new one, the types of EBV, the symptoms that correlates with each type, how to properly test, and I will give you a general idea how to interpret these tests, how EBV works, and what to do to overcome the reactivations. If this is the first time seeing me, my name is Andi Bartholomew. I'm a functional nutritional therapy practitioner. I also do reflexology and Reiki in my clinic. I specialized in Epstein Barr virus because of my own journey with Epstein Barr. And I was totally alone. I didn't even know Epstein Barr existed until I was diagnosed with Hashimoto's, and I started looking into what thyroid diseases are, and definitely into autoimmune. And the more I read about it, the more books, articles, research studies, they all seem to mention Epstein Barr virus a little bit, but they didn't really go into deep end. But I felt, maybe because of my energy background, clinical background, I felt that that was something I needed to look into. So that's why I started getting into Epstein Barr virus. And I found out that my Hashimoto's was actually rooted in there. After I put Epstein Barr virus into latency, and I will tell you what latency is not dormant. It's not dormancy, what we think. My Hashimoto's antibodies went down. Of course, autoimmune stays with us, so I still have it, but I'm managing it, and I never ever touched medication. Now, saying that, it doesn't mean that I want you to get off medication. As I said, I'm not a medical professional. I'm just a nutritional practitioner. So please talk to your doctor. But my main symptoms were really, really bad fatigue, to the point that when I was driving home, and I used to be teaching in an elementary school part-time, at 1:30, I was actually falling asleep at the wheel. So it was really dangerous, and I had to stop driving for a while. And then I had really bad depression. So those were my 2 biggies with my Epstein Barr virus. I know that a lot of you have many other symptoms, and we will go through it. But this is how I found it. And then all through my nutrition courses, somehow I got acquainted with Dr. Kasha Kynes, and you will hear me talking about her because she's my mentor, and I do believe she's one of the highly research trained in Epstein Barr virus. If you don't have her book, please look up. And I thought I had it with me, but I didn't bring it. It's called Epstein Barr Virus Solutions, and the author is Dr. Kasha Kynes. So let's look at what is actually Epstein Barr virus. Epstein Barr virus is one of the 8 human herpes viruses, And did you know that this is one of the oldest viruses? It actually goes back to 90 to 100 million years. It was discovered about 51 years ago, 52 now because it was in 1964, by British researchers. Two of them were Dr. Anthony Epstein and Dr. Ivan Barr, hence the name Epstein Barr. And they identified this virus while studying Burkitt's lymphoma, which is a type of cancer very common in Africa with children. So I know if you Google Epstein Barr, Dr. Google will say that Epstein Barr is cancerous, and it's true. It can cause cancer, but you will see that it takes a long time, not just long time, but a lot of wrongdoing in our lives to get that way. It is one of the most common viruses in the world. 90 to 95% of the world population is affected by this, but that doesn't mean that they are actually have symptoms. Most of the people are actually asymptomatic, and they don't even know that they have Epstein-Barr. Most people get affected with EBV at some point of life. And I know there are a lot of questions coming in from my community, the Overcoming Epstein-Barr Virus community in Facebook. Am I going to give Epstein-Barr virus to my grandkids or my husband? And I say, you are contagious, but I have to say they already have it because they have been living with you. So I don't want you to be really concerned about this. We need to be aware that Epstein-Barr virus is a virus and it's contagious, but most of the people around you already have it. When children have some or no symptoms, so when we get it in early childhood, it is usually asymptomatic, or you might have had strep throat. If you had tonsillitis problems, if they took out your tonsils when you were a child, I would say 99% you had Epstein-Barr virus, because that's usually the very first signal of Epstein-Barr virus. Most people know EBV as mono or mononucleosis, and we call it here as a kissing disease. And it's because it's very common to get mono from Epstein-Barr virus in college or university years, hence the kissing disease. It spreads via saliva, blood transfusion, and also organ transplants. So I don't know now. I really need to look into it, but I'm not very sure if they are, or I shouldn't say I'm not very sure. I don't know if they check blood for Epstein-Barr virus when someone donates blood. And so in old days, they did not check it. So definitely that was one of the reasons that people got Epstein-Barr virus, because it was not checked. So people who never have been exposed to EBV and get blood transfusion or an organ transplant, they could get actually very sick from Epstein-Barr virus. So let's look at what the medical society thinks about Epstein-Barr virus and how they view it. So just a few years ago, doctors did not really pay attention to EBV at all. Nowadays, and I'm thanking it because it was brought into light. And I don't know if you know Medical Medium. I think he was a huge part of Epstein-Barr virus coming into the spotlight. most of the doctors know about Epstein-Barr, but they are still on the fence and saying it's a one-time infection, and they don't recognize that we could actually have chronic mono from it. We could have reactivated Epstein-Barr from it, not just chronic mono, but reactivated Epstein-Barr. They do not recognize, as I said, chronic mono, and it's because there is no education about this. They don't have the time to do the research. I mean, you know that you go to the doctor and you have 10, 15 minutes with them. They don't have the time to do the research, and it's not their fault. It's the way this whole medical society is set up, and they don't have the training also. Even the infectious disease doctors are trained in more severe, and I should not say that nowadays because EBV is severe now. But like Ebola or other types of viruses that are really can affect a person and can cause death in very short period of time. So what they do, they usually just say rest, sleep, and drink plenty of fluids. They don't really understand that there are components that we need to look into, and definitely our lifestyle, and you will hear me talk about this one. A lifestyle is a huge component to get better from Epstein-Barr virus. Some may go a little bit further and give you an antiviral medication, but I will tell you that research studies shows that antiviral medication do not perform long-term. So even though you're might feel a little bit better for a couple of weeks, EBV will come back and create more symptoms that was not even there beforehand. So the other one that they are very reluctant to test for Epstein-Barr virus. And again, it goes back that they have not been taught how to truly interpret Epstein-Barr virus antibodies. And I will show you what they miss and why they are only saying it's only past infection, which what they look at is definitely what it shows, but they are missing some antibodies. So let's look at some research studies that will show you that Epstein-Barr virus Epstein-Barr virus needs our attention. And this one is one of the brand new ones. It was published in the Science Translational Medicine in November 2025. So it's pretty brand new. And this one was actually a groundbreaking study because they have been studying lupus with Epstein-Barr virus. And there have been studies that they were trying to connect it, but they didn't really know what was going on. And this study is actually giving us a little bit of more on the root side, why might be there is a huge connection with lupus and Epstein-Barr virus. The study found that EBV infects a small subset of autoreactive B cells and reprograms them into antigen-presenting cells that mistakenly respond to the body's own tissue, fueling the development of lupus. So what it says that they are really connecting, and they are saying that it seemed like likely to be directly driven by EBV protein EBNA2. And this is the protein that they find in other research studies as well. Okay, so this one was a huge one. This actually shook our nutritional society, because I don't think doctors don't know about this, but please let them know. There is a huge research study that was done in 2018 a team of researchers led by Dr. John B. Harley at a Cincinnati Children's Hospital performed a detailed genetic analysis to investigate the relationship between EBV infection and lupus. So they were actually trying to get to see what was the relationship with between EBV and lupus. But what they found shook the whole research group and us too, nutritionists. What they found that is they found that a viral protein, again EBNA2, was present in 7 major autoimmune diseases. These findings suggest that EBV infection drives the activation of genes that contribute to the individual's risk of development autoimmune diseases. And then these are the 7 autoimmune diseases that they found this EBNA2 protein. So it's the lupus that we talked about, and then now we have a much stronger research study that shows the correlation between lupus and EBV. They found multiple sclerosis, rheumatoid arthritis, juvenile idiopathic arthritis, inflammatory bowel disease, celiac disease, and type 1 diabetes. This is huge because if we think about these autoimmune diseases that is fueled by a viral infection, maybe putting this viral infection under control will help the body not attacking these cells that are creating these autoimmune diseases. So there's a lot of wonderful things out there that we can actually look into. One thing that was very interesting, because if you actually just put this in a research study, Dr. Harvey, I think, is that what I said, Harvey? Yeah, Harley, Dr. Harley, John B. Harley, Cincinnati Hospital, and just ask about EBV research, you will actually get a video, and they are going to tell you, there's a little interview with the researchers saying that they also looked into breast cancer. They say that they need more research studies, but what they found that EBNA2 protein was present in a lot of the breast cancer clients that they used as in the research study. Now we know that breast cancer has different causes, or I shouldn't say causes, but different types of breast cancers. So I don't know which one they were referring to, but if this could go on and they could research that, it just made me feel it was very personal for me, because I lost my mom to breast cancer, and she also had thyroid problems. Now, she never was diagnosed with Hashimoto's or Graves', but the autoimmune thyroid, but I know that there was something there, and who knows, if I had EBV, she had EBV too. The other one that was published in 2022, this one was led by researchers at the Stanford Medicine, and they were looking at multiple sclerosis and EBV, and they were saying the same thing what Dr. Harley was saying, that they found a connection between multiple sclerosis and Epstein Barr Virus protein EBNA2. So you see, even though there are research studies on that was connected the 7 autoimmune diseases in 2018, there are more and more researches are coming out stating that, yes, the research study in 2018 was the foundation, and now we have more research studies to look at Epstein-Barr virus. So there are more research studies between 2019 and 2022, and they linked Epstein-Barr virus to a lot of other conditions. And one of them was chronic fatigue syndrome, or ME. These research studies did not state that Epstein-Barr virus was the only cause of chronic fatigue syndrome, but they were saying that there was a huge contributing factor from the EBV reactivation over time that could have ended to CFS. What they found is that some of the patients with CFS have elevated antibodies to the early antigen, and what they ask is they would like people with chronic fatigue syndrome to go and have tested for Epstein-Barr virus. This one was a big one too. Dr. Voidani is another name besides Dr. Kasha Kynes. He is another really big name in the viral community, and also Dr. Vasquez, Alex Vasquez. They are, if you just Google their names, a lot of viral things coming up. They researched not just Epstein-Barr, but other herpes viruses or cytomegalovirus and so on. So Dr. Voidani acknowledges that EBV is one of the factors that could contribute to inflammation and autoimmunity in long COVID. And this was right after long COVID. It was done in 2023. And what the study says that reactivation of latent viruses, latent meaning not active in the body, but it is active in an organ where it hides, such as Epstein-Barr virus and human herpes virus 6, in long COVID has been associated with severity and length of COVID-19 symptoms. And look at the symptoms. Look at the symptoms that they list for COVID, long COVID: fatigue, brain fog, difficulty sleeping, pain in joint, muscle pain, pharyngitis, fever, headaches, gastrointestinal symptoms, skin rashes, depression and anxiety. They are all connected to Epstein-Barr. This is exactly what I see and hear from my clients, and I know that you might be, you might have these symptoms as of now, if you're here with Epstein-Barr. So what Dr. Vaidani was asking, that people who did not get better after COVID and having long COVID symptoms, just like these, it's recommended to check for Epstein-Barr virus. And this is just the same thing, that it can contribute to clinical symptoms, neurological and GI symptoms, as well as the gut-brain axis is a huge component in Epstein-Barr virus. All right, so let's look at the types of Epstein-Barr virus that we could have. And we are going to look at acute Epstein-Barr, chronic active, severe chronic active, and I'm going to talk to you about chronic reactivation of Epstein-Barr virus. So acute EBV is usually called infectious mononucleosis, kissing disease, or in Europe or in Africa, they call it glandular disease. 30 to 50% of young adults get the full-blown symptoms, according to research studies. Symptoms, and this is very important, symptoms usually start about 6 weeks after exposure. This is huge. That means that for 6 weeks, that person is already infectious, kissing everyone, drinking from the same glass, sharing glasses or so, spreading Epstein-Barr, but the symptoms are not going to come out up until 6 weeks. This might be the reason why EBV is so common in the world. So I told you that in childhood the symptoms are mild, and but as we age, the severity of the symptoms increases, and over 40, it could really hit us hard. That was me. Right after 40, I don't know, 47. One very important thing that we need to know about EBV is that even healthy people shed the virus intermittently months after the infection. What it means is they are asymptomatic, no symptoms at all, but they still have active virus that can infect other people. Here are the most common symptoms with infectious mononucleosis. And this is from research studies. Everything I show you are from research studies. It's not from me. It's not from a book. It's based on research. So just look at these symptoms and I will tell you some very interesting research on it. 100% of the people in the research study who were infected with Epstein-Barr and had mono have difficulty swallowing. Yes. 95% of the people have had sore throat. 50% had muscle pain. 90% had significant fatigue. And this was one of the biggie one for me that I was like, what? 75% of the people in the research study had headaches as the only symptom for their Epstein-Barr virus reactivation or infectious mononucleosis. So this is huge again, because what do we do when we have a headache? We usually just go for whatever is in your cabinet to get the pain, and then we are done. We don't even think about that this could be one of an viral replication going on in our body. And if we are not kind of immediately suppress it or getting it under control over the months and maybe years, it could create more and more symptoms. And of course, 50% had fever also. In some cases, EBV can create complications, and these are like ruptured spleen, breathing problems, chronic fatigue as a diagnosis. So let's look at chronic active Epstein-Barr virus, which is very serious. And I see a lot of people now saying that I have chronic EBV, and I always ask, have you been diagnosed? How did they diagnose it? Because there is going to be a very specific way to actually diagnose chronic Epstein-Barr virus. It is very serious. So these are the symptoms, and I think you see that very similar. Plus, we are going to look into liver and spleen enlargement and complications. Now, there are, in the research studies, showed that with chronic EBV, chronic active EBV, I should say, there were some very odd symptoms coming out, like severe sensitivity to mosquito bites, nosebleeds, vertigo, ear buzzing and ringing, allergies, and of course, other coronary aneurysm or valvular disease too, which are really serious. Now, I don't want you to think that because you have vertigo or because you have allergies, you have chronic Epstein-Barr virus, and I will tell you why. Here are the proposed guidelines to diagnose chronic active Epstein-Barr virus. And this is very important that your infectious disease doctors know how to do this. One is what I want to say, that chronic EBV, chronic active EBV, is still very rare. I know there are more and more people getting diagnosed with this, but it's still very rare. And these are the 3 guidelines that needs to be met to be diagnosed for Epstein-Barr. One is persistent or recurrent infectious mononucleosis-like symptoms lasting more than 6 months. Unusual patterns of EBV antibodies and increased complete EBV DNA in affected tissues. This is exactly what they need to know. They need to actually test the organ that is affected, like I said, liver, spleen, thyroid maybe. They have to actually do a DNA tissue analysis, and the number has to be over 10,000 to say that, yes, we are seeing one of the guidelines. Then you have the 6 months or more than 6 months symptoms, like infectious mononucleosis. Still not enough to diagnose you with chronic EBV, chronic active EBV, because we need to know there is no other diagnosis or any other disease processes when the person gets diagnosed. So this is very important to understand, and I want people to know this, that I know that you feel really bad. I know that the symptoms are awful, and some of my clients cannot even get out of bed. This doesn't mean you have chronic active Epstein-Barr, and I'm saying it because this is very severe, very serious. It could end up cancer. So I want you to stop there and just look at your symptoms and say, yep, I have reactivation. We need to look into what we can change, unless your doctor wants to do a DNA test to make sure that nothing is out of control. And then the last one, because we have 3 types, and now we have the reactivated EBV that we are seeing more and more, and definitely after COVID. This is the severe chronic active Epstein-Barr virus, and this mostly affects children under the age of 15. Unfortunately, it's usually fatal. But saying that, there was a wonderful study by Dr. Flavin. She actually reversed spleen disease in children who were affected with Epstein-Barr virus with supplements. And the supplements that she was using in high dosages were the ones that I'm using in my clinic, based on Dr. Vasquez and Dr. Kasha Kine's research, because they went deep into, based on Dr. Flavin's research studies, and made it very specific what is included. And I will tell you, of course, which ones they are. And Dr. Flavin said, and this is quote, EBV is treatable and can be rapidly reversible. And I want you to keep that in your mind, because there is hope, and we can get better. Look at me. I'm totally symptomless, if I say. Do I have reactivations? Yes. But I do not go into the whole frenzy that I used to have. And let's look at reactivated EBV. And I think this is mostly what we are seeing And I think you might be experiencing right now. Chronic reactivated EBV is the virus that stays active for a prolonged time. And what I say is reactivation goes in and out, or up and down, up and down. Anything can reactivate EBV, and I will talk about that one. The biggest one is stress. If you are in constant stress, if you cannot have your body have a rest going into parasympathetic state in between these stressors or stressful situations, EBV is going to reactivate. So you can have reactivation after reactivation. So here are the symptoms for chronic reactivated EBV. Again, we are seeing low-grade fever, muscle pain, headache, depression, sore throat, persistent fatigue, swollen lymph nodes, usually over here around our throat area, under the ears, aching legs, weakness, digestive issues. And if you see them, you might think, oh, this is almost the same as like long COVID, or the same, very similar to the chronic active one. Yes, but we don't have those guidelines met. So we are just having the symptoms. All right, testing for EBV. I know that a lot of you are very interested in this one. The very important thing to know that we have 4 antibody tests, not 3, not 2, that usually are tested in a medical field. And I want you to know that all 4 of them are very important to actually looking at if you're in a reactivated state. So let's look at in a general overview of what they mean. So we have VCA IgM. This is usually this antibody shows up positive when this is your initial infection. So if you had Epstein Barr virus when you were a child, and that was me, I had a lot of strep throat, strep and EBV. They are like sisters, brothers, siblings. If you had tonsillitis, you had Epstein Barr virus, 99%. So your VCA IgM that time, if they had been tested you, would have showed positive. Now, if they test you, this VCA IgM, because you already have Epstein Barr virus in your body, most of the time shows up negative. Now, saying that, since COVID, I have been seeing many people with the IgM showing up positive. There are no research studies yet, or I should say that, I haven't seen a research study why IgM is showing up now all of a sudden positive. I think I need to look into it definitely. But most of the time, I would say VCA IgM shows negative after the first initial infection. VCA IgG, this shows up positive right away. So you get the infection in the body. If they test you on the first day, they will have VCA IgG show up positive. Now you remember I told you that symptoms show up 6 weeks after Epstein Barr virus exposure. So VCA IgG has been positive for 6 weeks at least before your symptom shows up. EBNA IgG, and then VCA IgG will be positive for life. So it will show up positive. So I don't want you to worry about that too much, that, oh my God, that number is still 550. It just doesn't go down. It's going to be positive. EBNA IgG, on the other hand, shows up a little bit later, usually after 6 weeks when the symptoms are starting to show. And this is a good time when symptoms start to show, a good time to start testing. this is one of the other antibodies that will stay positive for life. So VCA IgG and EBNA IgG is going to be positive for life, no matter what. Now, the last one is the one that's usually missing. And this is called the early antigen D IgG. This is exactly what is going to show up during reactivation. So this is the antibody that we need to have to make sure, and we need all four actually. I shouldn't just say that test for early antigen, because I want to see the VCA and the EBNA2, the numbers, because they go up and down with reactivation also. But early antigen is the one that is usually missing, and the doctors don't even know about it. And I tell you a story. One of my clients actually called up because we wanted to test her. So I gave her the 4 antibodies. She went to the lab and then she calls me and say the lab doesn't have a code for early antigen. And I said, what do you mean that the lab does not have a code for early antigen? So I had to provide it. That's just like red flag for me. I wouldn't go to that lab. Anyway, so early antigen is very important, but what we need to know, and these are, when we are interpreting test results, we need to look at very important factors. And number one is the testing window is quite short. So, and when I'm saying it's quite short, I'm talking about the early antigen, because early antigen has about 14, maybe 20 days showing up positive in the blood. After that, it goes out of the bloodstream and it's not detectable. Saying that, it doesn't mean that you are not reactivated. It just shows, it just tells us that we missed the window. So when people ask me, when should I test? I always say, test when you feel the worst. When you feel that you cannot move, you feel like a truck ran over you, go and get tested. I know that's the hardest time, but that's exactly when we need to have tested. But even though my clients, for example, come back and early antigen is negative, what we do is, and this is very important, I don't just look at blood tests. Blood tests, no matter what, it's just that time of your body, what it is and showing up. I really look into your symptoms, your history of symptoms. I look at any patterns that might show some trauma, some accidents maybe that show up in your lifetime. And with that, we will actually create a timeline of symptoms, events, traumatic events that was might have been contributed to reactivations all through your lifetime up to now. And also, I want to tell you that some tests can show false negative and positive. It's with everything. These are not 100% tests, but they are getting very accurate. But I know you're going to ask me about PCR. So let's talk about PCR a little bit. PCR is actually it's not actually a blood test. It's actually looking at a DNA part of. So that would be something that to look at when they want to diagnose with chronic active Epstein Barr. So PCR in the research studies showing us that it's not accurate to say if you're in a reactivated state. EBV PCR, and this is from the research study that is under there, 2005, EBV PCR is positive in only 3% of sera with elevated antibodies against early antigen, raising doubt as to the utility of early antigen titers for diagnosing EBV reactivation. What it means is early antigen was high, PCR was negative, so it's not, only 3% of PCR was positive and early antigen showed up positive. So it's not for reactivation. I don't recommend it. First of all, it's pretty expensive too. And we have much better tests, early antigen. Okay, so let's look at how EBV works and what makes it different from other viruses. And I think this is going to be very interesting. I am not a science geek, I'm not a biologist or chemist, but this was really like eye-opening for me. So stage 1 and 2, this is what we are going to talk about. So stage 1 is when the virus enters the body, usually through the tonsils, and infects the host cells. Now, I wrote down 3 that could be affected by this virus, and B cells is blackened out because in the northern hemisphere, we see more B cells that are infected, and then the other hemisphere, we are seeing more T cells. We don't know why. Research studies has not been able to tell us why. And also, we see NF-kappa B, which is a inflammatory protein. And this is very big because inflammation is huge with Epstein Barr virus. And Epstein Barr virus actually reacts to inflammation. It's like, ooh, there are toxins. Ooh, I can actually feed myself. So NF-kappa B is one inflammatory protein that we really need to work on lowering, even though sometimes we need that to go, for example, if there is an accident, and then you need to have that NF-kappa B to create inflammation to protect. But in this scenario, we want to lower the NF-kappa B protein. And we do that through diet, by the way. So first stage, the virus enters and infects the host cell. And then stage 2 is when it actually enters into the cell and starts just totally destroying the whole cell and changes the host cell. What it does is actually changing the cell's DNA. And this is huge because most viruses that live in our body do not mess up with our DNA, the cell DNA. They are just infect the cell, and then the immune system comes and gobble it up and takes it out. Think about shingles. Shingles lives in our body. This is, again, a shingle virus. It has its time frame, I don't know, 6-8 weeks, brings on all the symptoms, the rashes, and everything that goes with it. I'm one of the lucky ones, knock on wood. I don't have shingles. And then it goes away because the immune system is able to recognize these infected cells and take care of it. With Epstein-Barr, this is totally different because EBV actually changes the DNA of the cell. It makes the cell unrecognizable. So the immune system is just going, oh, there is the cell. I know that this is infected. Oh, you're not infected, goes away. Because this cell is not recognized by the immune cells that are taking care of viruses, bacteria, and all kinds of pathogens. They did not recognize this B cell, T cell as an infected one. The other thing that happens is every cell that has that got infected, anything, bacteria, virus, pathogen, they have a signal. that they send out that please come and destroy me because I'm infected, that signal has been turned off also. So this cell is totally unrecognizable. It cannot send us signals. And also the third one, I don't know why I did not put that in. Oh yes, it does. It cannot terminate itself. It cannot commit suicide. The cells have these wonderful skill that if they are affected, they can actually, within certain period of time, if they are not destroyed by the immune system cells, they are going to destroy themselves. This also was shut down by the EBV. So I hope that you are now seeing and understanding that why you're just keep having more and more symptoms and you're not getting better, because this virus is just spreading without anything that could stop it. Stage three is what we call the latent stage, and this is actually inside the cell, and this is when this happens between reactivation. And I would say this is one of the most important stages. This is when EBV goes into a hiding place, as I said, liver, spleen, somewhere toxic. That's what it likes. So let's look at it. As I said, that there is an incubation period, that's 6 weeks when we don't have symptoms. And then this is when, after 6 weeks, eBNA IgG gets positive. Yes, and starting to create symptoms. The VC IgG, as I said, is positive from almost the very first time, the very first moment that the Epstein Barr virus gets into the body. So the virus is in our host cell, already cloning its RNA and DNA and creating millions of little virions. So we are in the host cell, okay? This is where we are. This is right here. We are in the cell, and look at it. Millions and millions of virions are going to be created in the affected cell. So one cell can actually hold, who knows how many infected little cells in there. And then this is usually the time when EBV is in this state. But then when reactivation happens, all of these little virions are starting to burst out of this cell, of the organ. And that's why we usually feel one day okay, and the next day we are like, whoa, what happened? This is exactly what happens, because all of these millions and millions of viral virions are out of the body, out of the organ. And stage 4 is the lysing stage. This is when they burst out of the host cell and creating all your symptoms, fatigue, sore throat, fever, headache, depression, and so on. This is the time when we can actually test for early antigen to get the proper positive results. Remember, we have all of about 14 days. I wouldn't even go over. 14 days is our window to get the positive early antigen IgG. As I said, even though you are testing negative for early antigen, based on your symptoms, history, we could actually figure out if you are in a reactivated state. So latent stage, as I said, is the most important stage. What the research says is latent mechanisms are responsible of sustained infections. EBV relies more on clonal replication of infected B cells for maintenance of infection in the host cell. So this is where this cloning is happening in the cell, the B cell, that is actually resting in the hiding place and creating this little virus. So let's talk about reactivated EBV that we see right now, and definitely after COVID. In my clinic, I have to say that I have seen an enormous number of reactivation after COVID. And I have to say that the population is over 60 that was affected, and they never even had before anything like this. So they are really trying to grasp what is going on. So after the initial infection, EBV stays in the body for life, and reactivation can happen for many, many reasons. Usually there is something else going on in the body. So it can be activated by bacteria like H. pylori. It can be a yeast like Candida. It can be another virus like COVID, or even shingles in some people. It can be by fungi like a mold. If people are living in a moldy situation, EBV is going to keep reactivating until that mold is out of the body. So that's one thing that you need to know. Stress is actually number one. And then by other toxins from the environment and heavy metals. So there was a research study, and I really love this one. I think they really captured Epstein Barr virus, because the title was "Awakening the Sleeping Giant: Epstein Barr Virus Reactivation by Biological Agents." It was published in 2024. You can actually look at it and see it. So what do we do? Very, very important to understand that EBV is pleomorphic, which means that it can switch from latent to lysing anytime. So the very first goal is that we have to stop the replication. We are not killing, we are stopping the replication. This is very important again, because when you kill, you just kill the cell, but you don't kill everything. There are still cells that are going to start replicating. And then we are going to stop the replication to stop the lysing before it is full blown. When we have less affected cells going into latency, we are going to have less little virions created in that cells to burst out when reactivation happens. And then, of course, we want to prevent future activations. So what do you do to overcome reactivation if you're having symptoms right now? Unfortunately, there is no magic pill. So I cannot give you that, oh, you just take this and then you're going to be happy and no problem for life. There is no one treatment. There is not, the ozone therapy is not going to help you forever. Stem cell therapy is not going to help you forever. You're just going to go back over and over again. So what we need to know is stress is our number one reactivator if there are no other pathogens. So if there is no any other bacteria and stuff that we can just say, oh, I have nothing like that. It's only stress. So this is in the research. Stress is number one reactivator. So we need to really look at the stressors in your life and find out what we can do to bring the body back after a stressful situation to calm it down. Because stress creates a lot of toxins through many different pathways. Your adrenal is going to be affected. your cortisol with that one is going to be really high. Your blood sugar is going to be up and down. Your liver is going to be affected because it does not have the capacity to take all of these toxins out. And also your gut is going to be affected. 70-80% of our immune system is in our gut. So we really need to start looking at our lifestyle, diet, and stuff. So when you look at your healing plan, you must start recognizing your stressors and start lowering the load. The next step is usually, and this is actually what I start with. And the reason behind it, I will tell you immediately. I start with these antivirus supplements, and these are NAC, L-lysine, vitamin E, vitamin C, vitamin D3, and I put K2 with it because they are they need to be together. Selenium, licorice, and zinc. As you see, we have some minerals in there. Selenium and zinc are very, very important. And vitamin D3 is now really coming out in research studies and showing that every cell has numerous vitamin D receptors. Epstein Barr virus actually shuts down those receptors. So we are not able to take in the vitamin D that we might get from the sunshine. So we definitely need to look at vitamin D3, K2 in a pretty high dose. I'm telling you, and again, I'm not a professional. I don't know anything about you. I know my body. I'm taking 20,000 international units a day. And I'm in Colorado, so we have more sunshine. But still, because of EBV shutting those receptors down, we need more in the body to be able to get into those that are not shut down, those receptors. There is a very easy vitamin D3 test that you can do usually, I think about, I don't know, $45. And again, you don't even have to go to the doctor. And if you want to know more, just let me know. So NAC and L-lysine are amino acids. We know we have vitamins, and then we also have licorice, which is an herbal remedy. And we know that licorice is one of the best antivirals that is coming from Mother Earth. So with everything I'm telling you, I need to make sure that you understand that these supplements, even though they are in the research studies, are not for everyone. Just like medication, supplements have contraindications. For example, licorice, if you have high blood pressure, you cannot take licorice. So make sure that you talk to someone in your practice or who knows your history and stuff. And just wanted to quickly tell you that I have a 6-week supplement program, which are just really honing into these supplements. And if you do it one-on-one with me, I definitely go in very deeply and will tell you, because you're going to be my client. So we have a practitioner client relationship. I can actually research which one you can do and which one you cannot. And we will figure out your perfect dose. Everybody is bio-individual. I can tell you the maximum dosages that I would recommend if you are not working with someone. But you have to figure out your dose. Your body might not need that much, but they might need more. Okay, so before you start on any of the supplements of these and any kind, I really would like you to think about the side effects, the contraindications. We need to know the quality of the ingredients. And I am also a certified supplement specialist. I work with a team of people. We actually interview different companies and looking at very specific quality that matching what we want with our clients. So my quality ingredients are, it has to be non-GMO. I would love to have it organic, but it's just the price would be like tripled. So it's just not, and we have to take pretty high dose. So non-GMO, because for example, vitamin C, if it's not derived from food, uh, it is, I shouldn't say not derived from food because corn is food, but corn is usually the most GMO'd and pesticide and herbicide driven. So we definitely go with non-GMO. It has to be gluten-free, dairy-free, and heavy metal-free. So those are my quality standards that any kind of supplements that I recommend to my EBV clients, they have to match these. If they are wonderful and organic and blah, blah, but they have dairy in it, it's not going to work because we have to be off dairy. Dairy is very inflammatory when EBV is reactivated. You need to know when they need to be taken. Some of the supplements that I recommend needs to be taken without food, like the amino acids. Some of them has to be taken with food. How do you take them? Some of the supplements work really well together. Some of them need to be away from each other. For example, if you take D3K2 and there is the K2 in it, it's much better to be taken away from vitamin E because they are going to just, they're antagonists. So we need to make sure that they are not going to just wipe each other out and there is nothing left. You need to figure out your perfect dose. As I said, I can tell you the max dose that I would recommend, but you need to figure it out. And the way I would do it, start with one supplement, go up as high as you can without any symptoms, and then add the other ones one by one. Know when to stop taking them. These supplements, and not just these, you should not take supplements forever. This is not how our body works. Our body is an amazing organism that if we give the right food, and food is the huge, it's like this big word, food, has to be quality and mineral and vitamin rich. This is why most of us are so mineral depleted, because our food is depleted. So we are trying to manage with minerals but man, we need so many minerals. I don't want to take hundreds of pills every day. So I'm trying to use really good food to help my body. So we need to know when to stop them. And also we need to figure out a maintenance dose. So I would say, if you figured out your active dose, your high dose, I would say, okay, just go for 1 month and then go off of it and see how you're doing. If your symptoms come back, go back again. But after 2 months, I highly recommend that you work with someone who is knowledgeable about this. And of course, I have a 6-week group program too, and one-on-one. Dietary changes. We are still doing phase 1. You need to get on fiber and antioxidant-rich foods that support our gut microbiome, like fermented foods too. Now, again, this is very individual. Some people cannot take fiber, so we need to look into that one. But if you are able, I highly recommend that you bring in fiber. Fiber is only in vegetables. You cannot get fiber from meat. So fiber is only in vegetables. So I want you to get more leafy vegetables, and if you can get the cruciferous vegetables, the broccoli, the cauliflower, those are really, really full of vitamins and minerals for us. Need to avoid gluten, dairy, eggs. They are all inflammatory. Eggs actually is in a research study with Epstein Barr. Dr. Voidani did the research. It can actually create allergy reactions to eggs. Epstein Barr virus can create allergy reactions to eggs. We don't want that. So I highly recommend to get off eggs until while you are healing. I was off eggs for 4 years, and now I have my own chickens. Christy knows that. Get off coffee, alcohol, because they stimulate the adrenals, and adrenals are already ramped up. Processed food, you know that, inflammatory, anything that is not in its original state, that it comes from earth, should not be eaten. Of course, there is minimal processing when we are thinking of meat. We cannot just eat the whole chicken with feathers and stuff. You're processing a little bit, but you know what I mean. Corn and soy, I would take it out, mostly GMO, inflammatory, toxic. Talking about soy, you know, I do believe that soy is a wonderful, really vitamin and mineral rich food, but it's just so bad in this country. So I'm just saying, stay away while you're healing. I sometimes have miso, which is a fermented tofu, soy, and on and off I put some organic edamame soybeans in there, but that must be organic. Okay. Number 4 in the step is you have to reduce your toxicity. You have to think about your external and your internal environment. As you're cleaning out your diet, you're actually cleaning out the internal environment a little bit, but you also have the external. And anything that touches your skin goes through your nose, you swallow, is going to affect your body. And I'm thinking about candles. I'm thinking about laundry detergent. I'm thinking about the car refresheners. I'm thinking about makeup for women. I'm thinking about skincare. I'm thinking about the plastics that we are using in our household. Even plastic cutting boards. Each time you cut on it, it's going to have microplastic going in. I'm not saying you have to get it out by tomorrow. I've been cleaning out my kitchen for 10 years. And now I can say that I have no plastic in my kitchen. I have plastic covers on glass. Like I have a glass container, and I put a plastic, those things that just clap on. But when I put my food in, the food never touches that plastic. So I always go lower. Microwave is out of my kitchen 4 years now, and we never get it back. Learning triggers and symptoms. Again, the supplement protocol program has some help with that one, and also I help. You need to learn what triggers your EBV. Yes, you have stress, but other stuff could be anything that causes good stress or bad stress is a stress, no matter what. So I would look into like lifestyle stressors, and not just think about your family and you know, just workplace, but anything that could create triggers. For example, I know my trigger is flying. So I really got on my protocol 2 weeks before I travel, and then stay on for another 1 or 2 weeks while I'm in my destination. So I reduce that reactivation. Self-care. I put it 6, but this is really important. And I'm not thinking of massage right here, but I'm thinking of sleep. You need to have a social life that actually creates happy hormones, which is the oxytocin. Oxytocin is on the top of the hormone hierarchy, and I talk about this in my group. If you're not in my EBV group, please join us in Facebook. Exercise that supports the body, and I'm not talking about HIIT training or heavy cardio, when you have reactivation, you actually slow down. You can do a little bit of stretches. You can do walking, but the walking needs to be under control too, so your pulse do not go over a certain amount, because then it creates oxidative stress, and stress is stress. Mindfulness and spiritual work are very important in the healing one. So as I'm saying, we can get EBV under control, but we have to have a whole plan, which is around our lifestyle. This where you are now has not been created overnight. It's been going on. The body is adding more and more toxicity in layers by layers. And when the body was toxic enough for Epstein Barr virus, he's just like, yay, I have food, and burst out of its place. And that's why you are here. So I want you to really look at your lifestyle and start looking at what you can do to reduce the stressors in your life. All right. Yay! We're done. I hope you gain understanding about EBV, the medical society view, the research studies that are saying. We know now the 8 types of EBV and their symptoms, what we need to have to be diagnosed with chronic active EBV, which is severe, the 4 important antibodies and what they mean, how this virus works, and how we can look at our lifestyle to create a better environment for EBV to go back to latency. So this is how I work. I have one-on-one in my practice. And if you're in Colorado, we can do in person too, but I work online. I have 4 and 6 months. And that was in November, the 2 spots. And I usually work one-on-one for 6 months with 2 people, because it's very, we are on almost every day. And then I have a 6 months Reclaim Your Spark group program, and a 6-week supplement protocol program that I do for my clients. And one thing that I want you to know that I just created this one, and this is for the people who do not need hand-holding, because I know that many of you are already done tons of research. Now what you need is like, give me the first step, give me the second, the third, and you know what to do with your diet and so on. So I created a self-led, practitioner-guided 6 months program, which is going to start in February. I'm going to have more info in my group, Overcoming Epstein Barr Virus, or if you're on my newsletter, you will get some emails about it. But this is really for people, and the price is very, very low. It's $250 a month. We meet twice a week. The first time, I actually tell you what we are going to focus on that month. And then the last, I think the 3rd week is a Q&A. So you get me to ask me questions. But it's on you. There is no one-on-one support like I do in my other group programs or one-on-one programs. Facebook group, Overcoming Epstein Barr Virus. And if you're a health practitioner, just know that I do Power Hour, when you can bring your clients' files, and we go deep dive, and we create a plan of how you can proceed if we think EBV is in the picture. Because you're here, I would love to give you a 30-minute free clarity call where we can just look at what's going on and maybe find the right support, maybe not with me. Sometimes if I figure out that you have mold exposure, I am not a mold trained, so I usually refer you out. Until mold is out of the body, we cannot control EBV. So first you have to do the mold, and then you come back to me and we focus on EBV. And then if you want to get a complete EBV antibody test, here it is. It's It's through Auto Lab. You can just go on, create an account, and because I am the practitioner, you can actually click a little box to send your test results to me, and I would be happy to give you a 30-minute free and look at the results, what it means in your case. Here's my info again if you need to get in touch with me. My website is a little bit funky right now. I had a hacker. I had to take off 3 pages, so it just totally deleted. So bear with me. I'm trying to get those back. But my email is there. So thank you so much for listening. And I'm going to pause the recording. Was I recording? I was not recording. Oh, I was recording.